with a multitude of changes, and every day can pass.
All new places, different faces in a world where changes everywhere you turn.
Find a friend you can rely on.
Hold the helping hand that shares. Keep the company that will truly care.
MediCard.
The company that doctors build.
MediCard.
The caring and the expertise. We're here
To serve you through the years,
for all that life may bring. We're here
to help
your family live in health and grow your dreams.
MediCard.
Doctors build
MediCard.
the caring and the expertise.
Find in
MediCard, MediCard, find the healthcare that you need
in MediCard.
So happy rainy afternoon to everyone. Thank you all for finding the time and visiting our today's webinar. So my name is Quaylin Lagos and I will be your host for today's talk. As you all know, MediCard is celebrating its 35th anniversary. So happy 35th anniversary, MediCard. So before we open our second webinar of the week, I would like to give you a glimpse of our celebration. So last Monday, we had the very first talk show, the MediCard Talks, where we talked about overall health and well-being, of course, with our expert. And in addition to that, we also discussed the newest innovation of MediCard, which is the Talk to Doc telemedicine. And yesterday, we had a webinar also about diabetic eye disease with Dr. Joel Perez. Okay, so before we start our today's webinar, let's have a quick poll. So I would like to request our technical team to flash our poll for today. Okay, so may I ask our participants to answer our quick poll? So we have 5 questions here. First is, when did you last visit your dentist? And then the second one is, at what age should one start to see a dentist? And then for our third question is, flossing should be done daily. So what do you think? Is flossing should be done daily or not? And then our fourth question, how often should one visit a dentist? So is it monthly? Is it weekly, or at least every 6 months or yearly? Or for if there are participants who think that we should not visit our dentist unless we are feeling something in our teeth. Okay, and then for the last question, for what reason will you visit a dentist? Okay, so let's see. Okay. Okay, so 10% of our participants thinks that we should that he or she visited a dentist a month ago. And then 30% of our participants answered 6 months ago. And then there are others who answered a year ago. And then there are some who visited a dentist more than a year ago. Okay, and then for our second question, we have 50% of our audience says that we should start visiting a dentist as early as 2 years old or younger. And then 40% of our audience think that we should visit our dentist during our teenage years. And then some of them are answered early to mid-adult years. And then for our third question is, flossing should be done daily. So 80% of our audience answered that it is true. And then for our fourth question, So 90% of our audience, they visit their dentist at least every 6 months. Yeah. And then lastly, for what reason will you visit a dentist? So 70% of our audience answered it is part of their annual checkup. Okay. So today, before we start our webinar, we all know, aside from taking care of our eyes, which we discussed yesterday, today we will be discussing about having a good dental hygiene. So oral hygiene is vital to any individual's overall health and well-being. Studies have also shown that untreated oral diseases may increase the risk of adverse health conditions. Thus, maintaining good oral hygiene is important in improving your oral health and overall well-being. So to get to know more about good oral care and dental hygiene, we invited a guest doctor. She is a dental consultant and administrator of MediCard Philippines, and owner of the Tutti Frutti Oral Care Professionals. She also has an experience being a company dentist and a former associate dentist at St. Luke's Medical Center. And lastly, she is a member of Philippine Dental Association and Quezon City Dental Chapter. So without further ado, let us all welcome Dr. Audrey Eve Rufino.
Thank you. Good afternoon to each and every one of you. I would like to greet MediCard happy anniversary, happy 35th anniversary. 35 years of providing quality healthcare for everyone. Okay, so as our host mentioned, I will talk about good oral health, maintaining a good oral health. Okay. Yan, yung slide natin. Before that, I would like to know, how are you feeling today? So, sa 44 participants in the room, maybe you are feeling happy, or some of you in the workplace, maybe hungry na kayo, hindi pa kayo nakapag-merienda, or maybe some of you right now is suffering from toothache. Okay, sana I add value to you now sa ating discussion. Okay? So next slide, please. Okay. Why is oral health important? Let me share with you first the anatomy of our mouth. Our mouth, oral cavity is not just about yung mga ipin natin, okay? So, syempre, meron tayong iba't ibang parts ng oral cavity natin, which are, syempre, the lips. Let's start from the lips. Syempre, yung ipin natin or yung dentition, which composes of the incisors. Yung incisors, yung mga front teeth natin. Usually, ito yung ginagamit natin for smiling, for biting, yan. Canine, or itong tinatawag natin na pangil. So, it is used for tearing or shearing, yung mga food natin, yan. Bicuspids, or what we call premolars, aids in the chewing of the food. Same goes with molars. Since malawak or flat yung surface ng ating molars, sila yung ginagamit natin for chewing. Okay? So, syempre, part rin ng oral cavity is our gums, or what we call gingiva. So, ang healthy gums is pinkish in color. Same goes with our tongue. Dapat yung mga tongue natin, when you say it's a healthy tongue, dapat pink siya. Okay? So, yun naman, yung bell-shaped structure in our mouth, when you open your mouth wide, that's called the uvula. It produces saliva to keep our throat wet. Also, yung hard palate and soft palate, ito yung ngala-ngala. So, yung ngala-ngala natin meron hard dyan, hard palate, and soft palate. Okay? Next slide, please. So, punta naman tayo sa anatomy of our tooth. So, just a brief explanation, our tooth has a lot of parts as well. So these are the enamel, the outer covering of our tooth, and it is the hardest part of the human body. Harder pa siya than our bone. Okay? Enamel is translucent in color. So, medyo light passes through it. That's why medyo clear siya. Okay? Yung dentin naman, yan yung nagbibigay sa atin ng color ng ating pen. That's why sometimes may yellowish, may brownish, or may grayish. So siya yung nagbibigay ng color ng ating ipin. In Asians, like medyo dark colored skin, yung dentin natin medyo on the yellow side. Pag mga Caucasians or mga mapuputi or mga mapuputi, yun, yung color ng dentin nila is medyo yellowish. Pag mga black skin or dark skin naman, ang color ng dentin nila is more on the whitish side or shade. Okay? So, dentin is also the second hardest layer of the human body. Next to enamel. Next is the pulp chamber. Yung pulp chamber, ang makikita natin sa loob ng pulp chamber is yung ating mga blood vessels and nerves. Okay? Periodontal ligament, these are the parang hair-like structure which connects our tooth from our tooth to the bone. Okay? Next is the cementum, another outer covering of our tooth naman, which connects the periodontal ligament to the tooth. Okay? So, lastly is the root canal. It is where you find the nerves of the tooth. Okay? So, yung ipin natin or yung tooth is divided into two parts. The crown or the upper part of our tooth, yan yung nakikita natin when we open our mouth. So, yung mga nasa taas ng gums, ang tawag doon crown. Okay, yung nasa baba naman ng gums or hindi natin nakikita with our eye, that's the root part of our tooth. Okay? Tapos we move on to the other on the picture on the right side. Ito, nag-show dito yung mga location ng mga sira or mga cavities ng ating ipin. It can be ang sira ng ipin can be found minsan sa pits and fissure part of our tooth. Sa ibabaw, may mga pits and fissure yan, lalo na sa molars natin. Sometimes we see tooth decay or caries, dental caries. Sometimes nakikita naman natin na ang caries sa smooth surface of our ipin. So sometimes ito yung sides. Kasi sometimes hindi natin siya nababrush ng maigi, yung mga sides ng ipin natin. So sometimes nagkakaroon ng cavity doon sa area na yon. And can also be found, cavities or dental caries can also be found sa root part of our ipin. So, if nakikita nyo yung picture, meron dyan mga plaque. May nakalagay dyan plaque. So, yung plaque is a thin film or layer. Yung mga dirt yon. Nakadikit yan sa structure ng ipin natin. Maybe sa ibabaw, sa gilid, or all around our ipin. Okay? So, next slide, please. So, yan. Na-mention ko earlier, dun sa last picture, dental caries or what we call tooth decay or cavities. Okay? Ito yung permanently damaged areas in the hard surface of your teeth. These occur when bacteria in plaque, remember na mention ko earlier, yung plaque, yung mga dirt or mga food particles na get stuck on your tooth. Yung occurs when bacteria in plaque metabolize sugar to make acid. And then that acid attacks and breaks down the layers of the tooth, forming small holes called cavities. So, alam naman natin yung one way or the other, nagkaroon na tayo ng cavity, diba, sa lifetime natin. So, ito yung mga makikita yung black parts on top of your ipin or on the side. Okay? So, next, I would like to share also yung picture na to. Si Dr. Godoy, siya yung naging dean siya of my school, Centro Escolar University. So napili ko siyang picture. Diyan, nilagay ko siya dyan. Okay, now she's the chairman of the Board of Dentistry sa PRC, Philippine Regulatory sa Professional Regulation Commission. So yan, si Dr. Godoy. Okay, next slide. Okay, according to National Monitoring and Epidemiological Dental Survey, 92.4% daw of Filipinos have dental caries. Okay, 78% of that suffer from gum disease. And then, according to National Oral Health Survey naman, it revealed that 97.1% of Filipino children age 6 suffer from dental caries. And age 12 naman, 78.4% of children age 12 already have dental caries or is suffering from toothache. Diba? So, medyo matataas ang mga values natin. Okay, next slide. Worldwide naman, there are 3.58 billion people affected by oral disease worldwide. Pangkalahatan, okay? Hindi lang sa Philippines problem ang tooth decay or dental disease. Pero syempre sa buong mundo siya. Kasi yung iba, hindi sila masyadong maalam. Kaya tayo nandito is to add value to you para meron kayong matutunan tungkol sa oral cavity nyo. Okay? So, 3.58 billion. Diba? Ang daming people affected with dental caries. Okay? This is according to WHO. And children aged 2 to 5 have dental caries. 27.90% of children aged 2 to 5 have dental caries. And children aged 5 to 11 already suffer from dental caries. That's 51.17%. Medyo malaki siya. Tsaka medyo syempre, kaya nga tayo nandito, it's a good thing that you made time for this para naman maka-alam kayo or matuto kayo sa oral hygiene. Okay? So, next slide, please. Okay, ano-ano ba yung mga common dental problems that we experience? Kasi 'di ba, since medyo malaki yung ating percent or number of people who suffer from dental problems, I want to discuss with you some common dental problems. Okay? So, start tayo. Siyempre, ang most common is, next slide. Siyempre, most common yung dental caries. Like I mentioned earlier, dental caries or what we call tooth decay or cavities, these are the plaque, yung mga dumi ng ipin or mga food particles na nakadikit sa ipin, yun yung plaque. Pag kinuskus nyo yung teeth nyo, sometimes meron kayong whitish substance na makukuha doon, yun yung plaque. Okay? So, plaque plus sugar equals acid. And then, yung acid breaks the tooth structure and then becomes cavity. And it can cause you toothache. Pwedeng sensitivity, kung hindi pa masyadong malaki yung sira, pwedeng maging sensitive yung ipin mo, or minsan, pag sobrang lala na or pinabayaan na yung cavity, nagiging pain na siya, may masakit na, may toothache na, okay? Other symptoms may include bad breath, black or brown spots, unpleasant taste in your mouth. So, ito yung itsura. I place their photos para makita nyo ang itsura ng caries. Yan, may mga black or medyo yung iba dyan sa picture na yan, medyo malala na talaga siya. Okay? So, syempre, ayaw natin paabutin sa ganyang state na yung inyong mga ipin. Okay? So, next common is gum disease. So, yung gum disease, ang tawag natin dyan ay gingivitis. Gingivitis is the early stage and mild form of gum or periodontal disease. It is a bacterial infection caused by buildup of plaque. Common symptoms are red, swollen gums, and it bleeds easily. So, these are one of the common cause. Yung bleeding gums is dirty yung ipin or madaming plaque or dirty, madumi. Maybe hindi nagtutoothbrush or hindi nakakapagpalinis sa dentist. Yan. Kaya tayo nagkakaroon ng gingivitis. Ibig sabihin, yung plaque, nagbe-build up na siya, tapos hindi nga nagtutoothbrush or hindi nakakapag-cleaning. So build up siya ng build up hanggang naapektuhan na or nai-infect na yung gums natin. So ito yung itsura ng gums na hindi healthy. So medyo reddish na siya. Tsaka syempre, pag nag-toothbrush ka or naggalaw siya, magkakaroon siya ng bleeding. So yan yung gum disease or gingivitis. Ang gingivitis is reversible. Ibig sabihin, in the mild form, gingivitis is reversible. Ibig sabihin, pwede pa siyang gumaling. Gumagaling pa siya. Basta wag lang natin dapat paabutin sa periodontal disease kasi medyo advanced stage na yon ng gingivitis. Okay? So next is bad breath. Halitosis is one of the most common dental disease and is also among the most distressing. It can be caused by several factors including poor oral hygiene, dry mouth, acid reflux, infection, or sometimes yung sa food na kinakain natin, and also smoking. Smoking, yes, smoking can cause bad breath as well. So, yung halitosis, ito yung parang medyo distressing, sabi dyan. So, syempre, sometimes hindi mo alam yung pinanggagalingan kasi pwedeng inside the stomach or baka sa food lang na kinain mo. So, sometimes mahirap siyang i-pinpoint kung talagang saan siya nanggagaling. Okay? Pero one of the most common oral problem siya. Okay? So, next slide, please. Yan. Next is sensitivity. Your teeth become sensitive to hot or cold foods and drinks. When the enamel is worn away and the dentin is exposed, other possible causes include gum problem, root infection, worn out fillings, or erosion. Yung dentin kasi natin, meron siyang mga tubes, a lot of tubes, small tubes, na diretso sa nerve ng ipin. So, minsan kapag pudpud na ito, pudpud na yung enamel and the dentin, sometimes nakaka-feel tayo ng sensitivity. Or minsan, kapag meron tayong mga dental caries na, sometimes we feel sensitive doon sa teeth na yon. So, it becomes sensitive to hot or cold. Kaya minsan, di ba, sometimes din sweet. Minsan kapag kumakain ng chocolate, yan, parang minsan may nafe-feel ng yellow, or kadalasan cold, pagkain ng ice cream, yan. So, yan yung sensitivity. Okay, next is receding gums. Gum recession can also be caused by and lead to other serious dental problems like periodontitis and worse, losing your tooth. It can also be caused by other factors like poor oral hygiene, brushing teeth too hard, high blood pressure, hormonal, or smoking. So kanina, na-mention ko sa inyo, yung gingivitis is like a mild form of gum disease. Ito naman, nangyayari yung receding gums if you have advanced stage of periodontitis already. So talagang sumingit na yung mga plaque under the gums, and then since hindi siya natatanggal, and dentist lang ang makakatanggal nun kasi hindi na yun matatanggal ng toothbrush kasi nasa ilalim na siya ng gums. So, ito na yung mangyayari sa ipin nyo. And worse, sabi dyan, worse, you might lose your tooth. Diba? So, kapag meron kang periodontitis, it follows sometimes that gums recede or bumababa yung ating gums. Kasi nga, umiiwas siya ng iwas doon sa plaque. Ayaw niyang i-touch yung plaque, pero hindi naman niyo pinapatanggal yung plaque, So, nandun lang siya. So, iwas na lang ng iwas yung gums hanggang sa mababa na siya masyado yung connection niya. Tapos, bone na yung, kumbaga nasasagad na siya sa bone, tapos yung bone mo also, umiiwas din siya sa plaque or sa infection. Yun, eventually, you will lose your tooth. Kasi nga, wala nang connection, wala nang bone that holds the tooth. Okay? So, yan. Isa yan sa mga common dental problem, yung receding gums. Okay, next is root infection. The base of the root of your tooth can become infected and swollen with bacteria. Root infection can lead to damaged tissues and nerves of the tooth, which eventually develop abscess. Maybe some of you naka-experience na ng toothache talaga, di ba? Yung parang sobrang sakit, di ka makatulog, di ka makakain, wala kang magawa. So sometimes, bacteria already penetrated the inside of your tooth. And worse, napunta na siya sa root part. Okay? So ito yung example ng root infection. Sometimes, yung color red na circular structure dyan, parang nana na yan. So sometimes, di ba, parang gusto mo na lang siyang ipabunot kasi sobrang sakit na, hindi ka na makatrabaho. So sometimes it can be as small as that, and it can also be as big as sobrang laki talaga na kailangan mo nang i-opera. Kailangan mo na siyang ipa-drain. So syempre, ayaw natin umabot yung toothache natin sa ganung state na. Syempre, kailangan nating ingatan ang ating mga ipin. Okay? Next slide. Another common disease is dry mouth or xerostomia. This is a condition in which the salivary glands in your mouth don't make enough saliva to keep your mouth wet and is common among elderly. Causes are sometimes due to cancer treatments, diabetes, and some certain medication. Ang characteristic ng ating xerostomia or dry mouth is parang nagmamap yung tongue. So as you can see in the illustration, parang yung tongue niya parang very dry, para siyang El Nino, parang ganon. Very, very dry na parang yung yung tongue mo, kitang-kita na yung mga grooves. Nagmamapping na siya. So, sometimes it can also be due to cancer or yung mga medications na iniinom natin. So, yan. Hindi lang siya basta dry mouth na nauuhaw ka lang, ha. Medyo advanced stage na itong xerostomia. Sa mga normal people, sometimes nagda-dry mouth tayo kasi kulang lang tayo sa water. We just need to hydrate and drink more fluids. Okay? So next is tooth abrasion. Abrasion is a condition that develops slowly and leaves teeth sensitive, discolored, weak, and more susceptible to cracks and chips. Common to sa mga older people. Pero meron rin ganito yung mga young people kasi grabe sila mag-toothbrush. Sobrang diin. Tapos yung toothbrush pa nila hard bristles. So, talagang magre-result siya sa abrasion. Meron tayong proper brushing technique na maiiwasan itong abrasion na to. This abrasion can mostly be found near the gums. Sa kakatoothbrush nyo ng ganito. Yan. Sometimes na pupudpud yung ipin. So, meron tayong proper brushing para maiwasan itong mga ganitong klaseng abrasion. Okay? Next is teeth grinding. Teeth grinding or bruxism is a condition in which you grind or gnash or clench your teeth and most often occurs while you sleep. It can damage your teeth and can lead to jaw pain, headaches, or earaches. Some people suffer from teeth grinding if they have a sleep disorder or stressed or dealing with anxiety. Sometimes, most of the time, itong teeth grinding na to or bruxism, nangyayari siya during your sleep. So, itanong niyo yung mga husbands niyo or yung mga wife niyo kung nag-grind ka ba sa gabi. Maybe you're stressed at work or medyo dealing with anxiety. So, yan. kaya natin gustong malaman if we do bruxism kasi syempre meron tayong sinusuot na appliance sa mouth natin para to avoid maging pudpud yung mga ipin natin. Like yung sa illustration ko, if nakikita nyo, sobrang pudpud na, parang almost half of the upper tooth niya or upper teeth niya is pudpud na. So syempre, we don't want you to lead to this kind of illustration or state na kasi sobrang half na. Meron akong nakitang isang illustration na almost nasa gums na lang yung ipin niya. So sobrang tindi ng grinding niya. So syempre, you need to consult your doctor or your dentist kapag ganito na yung itsura ng ipin nyo kasi they might recommend you to wear an appliance for that. Okay? So next slide. I will want to go back to my first question. Earlier, I started with this question, why is oral health important? So now we can answer kasi I already gave you a background of the oral cavity structures. So why is oral health important? Next slide. The health of your mouth is linked to heart disease and stroke, sometimes can also be respiratory disease, arthritis, diabetes, gastrointestinal disease, and preterm low birth weight for babies. So, hindi lang confined sa mouth ang ang health ng ating body or 'di ba? Ang oral health is connected to your general health. It impacts the ability to smile, speak, taste, and digest proper nutrition. It also affects one's everyday quality of life. It can help prevent common dental problems, and it is essential to achieving and maintaining overall physical and emotional well-being throughout life. So, sa illustration, nakikita nyo naman yung sa mouth, ang daming pinanggagalingan ng diseases. So, some diseases can be found really or start from the mouth. So bacteria and plaque enters the bloodstream through the gums. It can also cause bronchitis, pneumonia, or chronic obstructive pulmonary diseases. Or sometimes your immune system can be weak because of gum and periodontal disease, diba? So madami yung mouth natin, madaming pinanggagalingan ng sakit. That's why, next slide. That's why every tooth in a man's head is more valuable than a diamond. Kasi nga, ang daming connection ng mouth natin, hindi lang naman ito, or hindi lang naman sa head, diba? So, diba, sabi sa illustration kanina, meron sa heart, meron sa lungs, meron sa bones, diba? Meron sa pag-conceive or yung mga birth ng mga baby. So, kaya dapat natin ingatan ang mga ipin natin dahil valuable ito than a diamond. Kasi you will only have one set of permanent teeth in your lifetime. So, syempre, kailangan mo siyang i-take care. Diba? So, next slide. These are some tips on good oral care and dental hygiene. Now that you know there are a lot of dental problems that can arise or maybe diseases that can arise from the mouth, it is just important that you keep your oral hygiene at its optimum, diba? So, next slide. Number 1 is to brush your teeth twice a day. Okay, let's watch this short video. Yan, okay? So, brushing is the sobrang basic part of our oral hygiene. Siyempre, I'm sure lahat naman tayo nagbabrush tayo ng teeth. Pero, minsan, nag-iiba lang tayo ng the way we brush your teeth. Yan I showed you a video para maging guide nyo sa pag-brush nyo ng teeth. Also, many people forget to change their toothbrush every 3 months. Siyempre, na-worn out rin yon sa paggamit natin ng toothbrush natin. So, if it's worn out, it's not that effective in already cleaning your teeth. So, we need to change our toothbrush every 3 months. Diba? Tapos, yung iba, sobrang nagmamadali mag-toothbrush. So, hindi rin siya magiging effective if nagmamadali ka. Ang suggestion ko is 2 minutes, 2 full minutes of brushing your teeth. And then, you brush, di ba, kanina sabi, circular, tapos all quadrants of your mouth, kailangan madaanan mo siya ng toothbrush. Tapos, kailangan rin mag-concentrate ka talaga sa pagtututbrush mo. Pwede ko rin isuggest na sa mga kids, if you have sons or daughters, you can sing happy birthday song. You can sing the happy birthday song twice. That's how long you should brush your teeth. Okay? So yeah, next slide. I do hope you are getting this or learning something from this. I just want you to know these are really very practical tips for your everyday life, diba? So yeah, let's continue. Make flossing a daily habit. Find the right floss. Use at least 16 to 18 inches of floss. Move it slowly, switch sections, and sometimes you can try a tool. Nowadays, in the market, meron na tayong mga available na floss na may handle or meron toothpick sa kabilang tip. So you can also use that. Just take note that you have to move it slowly. Not naman to the point na magdugo yung gums mo. Diba? So, syempre, dahan-dahan lang din. Kasi minsan nakakagulat na ganun mo siya, tapos nagdugo yung gums mo. And then, make a C, action, letter C, gano'n, no? Parang kukunin mo igaganyan mo yung plaque in between your teeth. Okay, so, yan. Sad to say, but brushing is not enough sometimes, especially when you don't do it properly. So flossing is a good supplement. Okay? We can floss twice a day, or maybe kapag busy ka or hindi kaya ng time mo, you can floss at night before sleeping. At least para yung mga in between ng mga teeth mo, malilinisan mo rin siya. Okay? So, ladies and gentlemen, make flossing a daily habit na. Diba? So, i-add nyo na siya sa everyday routine nyo sa mouth. Okay? So, next slide. Okay, brush your tongue. Siyempre, naman ipan yung binabrush natin. Siyempre, dapat binabrush din natin yung tongue natin. Okay? So, these are some tips to brush your tongue. Okay? Stick out your tongue as far as it will reach. Brush lightly forward and backward. Spit out saliva that appears during the brushing. Clean your tongue as often as you brush your teeth. Some use tongue scraper to clean your tongue. Ngayon, dati kasi, toothbrush is okay, diba? Pero ngayon, nakakapag-devise na yung mga companies ng mga tool. Ang tawag natin is tongue scraper. Minsan, may handle, katulad nitong nasa illustration ko. Minsan, isang straight lang siya and then you scrape your tongue gently like that. Minsan plastic siya, minsan metal na hindi naman sharp. So, if I were you right now, you invest in a good tongue scraper. Kasi isa rin to sa mga will keep your mouth clean. Diba? So, kita mo naman dito sa illustration ko, meron siyang orange or yellowish parang sa mouth, dirt, ay sa tongue. So, after niya, in-scrape, yan, naging pink na ulit, naging healthy na siya ulit, 'di ba? I mentioned earlier na yung pink tongue indicates healthy tongue. Okay? So yan, pwede na kayong mag-buy ng mga tongue scraper, meron yan sa mga supermarket. Yan, meron yan. Okay? Okay, next slide. Also, you can use mouthwash. Siyempre, kunyari, nasa office ka, tapos hindi mo nadala yung toothbrush mo, or at least meron kang dalang mouthwash para ma-rinse mo yung mouth mo after you eat, diba? So, because mouthwash usually contains antiseptic to kill harmful bacteria, rinsing twice a day can help reduce plaque, assist in reducing cavities, and freshens breath. Meron naman we have a lot of available mouthwashes in the market. So, kayo na yung pumili na according sa ano nyo. Kasi minsan, sobrang anghang or sobrang tapang. So, yan. I suggest you keep a mouthwash inside your bag para just in case na, parang meron kayong meeting or what, diba? At least makapag-rinse kayo ng mouth kahit wala kayong toothbrush. Okay, so this can also be a big help in maintaining your good oral hygiene. Okay, so yan. Slide. Of course, basic naman, we have to stay hydrated. One should drink at least 8 to 10 glasses of water a day. So, syempre, di ba, na-mention ko earlier yung dry mouth. Isa sa mga pag-iiwas ng dry mouth is to stay hydrated, lalo na ngayon, syempre, super init. So, sometimes yon nakaka-dry talaga ng mouth, tapos papawis ka pa. So, inom tayo parati ng water. Also, eat healthy food. Avoid food that contains sugar. Remember, I mentioned earlier, yung sugar is an aspect in developing dental caries. So, syempre, we would want to avoid sugar. Foods that contain sugar. Limit the number of snacks you eat. Syempre, yung snacks natin, paminsan kasi ito yung mga sweet yung mga matatamis na pagkain, yung mga snack natin, mga cake, ganyan. I'm not saying na bawal, pero you can limit the number of snacks or the food that contains sugar. If kumain ka ng sweet na food, pwede ka mag-gargle ng water. Kung wala kang mouthwash, pwede ka mag-gargle ng water para ma-wash lang yung sugar or ma-lessen yung sugar na nakadikit doon sa ipin mo. Okay, so yan, stay hydrated and eat healthy foods. Next slide, please. Yan. Of course, visit your dentist regularly. Very basic ito. Kanina doon sa poll natin, 'di ba? They ask you kung ilan dapat times ka nagvi-visit sa dentist. So, it is advised to visit every 6 months. Meron ka mang nararamdaman or wala. So, you really have to visit. Of course, syempre, sa pag-visit mo na yon, i-check up ulit yung ipin mo. Ayan, mag-baseline charting tayo ng ng dentist mo, tsaka ikaw. Tapos, may imo-monitor sila ng mga ipin mo, ganyan. So, regular dental visits are important because they help to keep your teeth and gums healthy. Kasi doon lang natin nalalaman na, ito pala, kailangan pastahan, or ito pala, ito malapit na itong bunutin, or ito kailangan ng denture, ganyan. So, madami ka talagang malalaman from your dentist, from your check-up with your dentist. Kasi, syempre, ang goal nga natin is, di ba, earlier nasabi ko, your teeth is more valuable than a diamond. So, you have to keep really your teeth well-maintained, di ba? So, syempre, gusto natin na parati siyang maganda, malinis, maputi, at walang sakit. So, yan. You need to visit your dentist regularly, with or without pain. Okay? So, yan. Itong illustration ko, yung guy or yung dentist, siya yung senior ko sa oral maxillofacial surgery. Si Dr. Lapan. Siya yung senior ko. Okay? So, yan. So, I would like to reiterate again and again and again, visit your dentist regularly. Regularly meaning every 6 months or more. Okay? So, yan. Next slide. Yan. I leave you with this, ladies and gentlemen. Poor oral health care can result in poor overall health care. Diba? So, nalaman natin na madaming nagmumulang sakit, systemic diseases from the mouth. That's why we need to keep our oral health care at its diba, at its optimum para maganda rin yung overall health natin. Okay? So that's all for now. I hope that I added value in you, diba? So makipag-appointment na po kayo sa inyong mga dentist ngayon, soon, di ba? Para makapagpa-check up na po kayo. And with all that said, thank you very much. Yan. I hope nagbago yung mga pananaw nyo or meron kayong mga natutunan sa webinar na ito. Yan. Okay? Thanks a lot. Next slide, please. Yan. Take care of your teeth and they will take care of you. Okay? So, yun lang. Have a nice day. Thank you all.
Okay, thank you so much, Doc Audrey, for the wonderful talk. So now we are opening the floor for the Q&A. So to facilitate, may I call on Dr. Pauline Faustino, Assistant Manager of MediCard On-Site Clinic Management and Health Promotion. Hi, Doc.
Hello, good afternoon, everyone. Good afternoon, Dr. Audrey.
Hello, Doc.
Yes, before we start with our reading out the questions, we'd like to acknowledge also the presence of our other dental consultants, Dr. Arnold Rivera, Dr. Fam Escopete, and Dr. Victoria Vergel. Ayan, so let's proceed. So earlier we had a glimpse of our participants' knowledge and practices on oral health. There were answers that we hope we have clarified through the discussion that you had earlier, Dr. So let's read out the questions now in our chat box so we can address other concerns that they have.
Okay.
So now, first question, Dr. What intervention can be done for receding gums?
Okay. We have, first and foremost, dapat hindi na dapat nahahantong sa receding gums yung condition ng iyong gums. But when it's already present, you need to consult a specialist na so that it can be addressed properly. So we have what we call a periodontist na mas extensive pa yung gagawing cleaning sa'yo. Kasi para yung mga nasa ilalim, ganyan, ma-clean and then matanggal talaga yung plaque na na-stuck dyan sa under your gum. So, that's the first step. And from there, meron siyang mga isa-suggest na maybe other procedures to correct. It actually depends on the severity of the condition of your ipin or the recession of your gums. Sometimes, so sobra na or advanced na yung recession, meron tayong pwedeng surgery na pwedeng to fix the recession. So, yun. Magpa-check up ka na po sa dentist para at least early po niya magkaroon ng intervention.
Yes. Earlier also we saw in the polls, no, there were people who were checked by their dentist more than a year ago na. So talagang based on your recommendation, at least every 6 months they should see a dentist. So another question, Dr. During the pandemic, how can I ensure that my dentist is safe?
Actually, from 2020, we dentists, we already had upgrades in our clinics, no? So I guess by now, it's really safe na to go to your dentist. Kasi nga, nag-follow na rin sila ng mga protocols natin. New dental protocols to make their clinic safe. So, safe na po tayo ngayon. So, don't make it a hindrance not to go to your dentist. Kasi, di ba, na nga tayo ngayon, level 1. So, if you have been not going to your dentist like in 2 years na, maybe it's about time, 'di ba? Kasi syempre na-discuss ko earlier na yung plaque kasi kailangan natin matanggal yan sa teeth natin kasi yan talaga yung nagiging source ng everything inside our mouth. So make that appointment, and I'm sure your dentist or safe na yon, safe na yon. Yung ating mga MediCard clinics is also safe. We are equipped with a lot of new equipments like yung ating mga aerosols, yung mga ating purifiers, meron tayong mga extra oil suction. So MediCare clinics are also safe. So make that appointment.
I think that also answers the next question that what would you advise people who are still nervous about seeking treatment because of COVID-19? So with the, sige, go ahead.
Doktora, kasi nga 'di ba ano na tayo ngayon, level 1 na tayo. Dapat hindi na rin tayo, mas ma-nervous po tayo kapag meron na tayong sobrang dirty mouth. At 'di ba, I mentioned earlier that a lot of systemic diseases comes from the mouth. So mas doon tayo nervous din, 'di ba? So make that appointment.
Okay, yes, okay, thank you. There's another question. Is it normal to have permanent teeth when you're born?
It's not really normal, but sometimes there are cases na, rare cases na nangyayari ito. Pero syempre hindi siya normal. So you need to go check with your doctor, your pedia doctor, or also your dentist. Kasi hindi siya normal. Maybe there are more serious complications because you have permanent teeth at the age of baby or 0, diba? So you need to have that check as well.
So even wala pang ngipin, kailangan lang makita talaga ng dentist.
Yes.
Okay. So there's another question regarding a fixed bridge. How many years, if ever, to replace it? Is there a need to replace it?
I would like everyone to know that our replacements or what we call dentures or replacements for missing teeth, they all have expiration dates. It's not when you put it there, it will last forever. Remember, we use it every day. So it is really subject to wear and tear every day. So meron talaga yung lifespan. So syempre, yung lifespan na yon, we can only parang estimate. Pero it still depends on you, the user, how you use your, let's say, kunyari yung fixed bridge mo, how do you use it? So, syempre, if medyo abusive kung ano-ano kinakain mo or kunyari mga matitigas, ganyan. So, it's just parang safe to say na syempre, hindi short-lived lang yung bridge mo, 'di ba? Kasi nga ina-abuse mo siya. Pero kung ingatan mo siya, like tama lang yung mga kinakain mo or more so, kunyari, vegetarian ka, syempre, ina-expect natin na maglalast longer yung fixed bridge. Pero to have an estimate, maybe I can say na in 5-7 years, pwede mo na siyang ipa-change. Maybe as early as 3 years, 3 to 5, ganyan. So really depends on how you use it. Pero it all has expiration dates. It all has lifespan. So it's not forever hanggang sa nandun ka na sa grave mo. Yun pa rin yun. Syempre, nagbabago rin yung ating ipin. Our mouth is not constant. It's not yan na, permanent siya, oo, pero hindi siya fixed. Nagbabago yung ipin natin as we grow old. Syempre, may mga changes na nangyayari dyan. So, kailangan, ina-up-to-date mo rin yung mga denture na sinusuot mo. Ina-update mo din. So, yan. So, meron talaga siyang lifespan.
So, it's the same, Doc, as the next question for permanent dentures. Same as the fixed bridge.
Yes. Fixed bridge, actually, Doctor, fixed bridge is parang, they say it's permanent because it's cemented on the tooth mismo. Kasi yung isa nating klase, which is the removable, syempre nare-remove yun. So you can clean it, ganyan. Yung fixed kasi, naka-cement siya. That's why it's called fixed. Pero, just the same, all have lifespan. Okay?
Okay, noted, Dr. So the next question, is there a solution to dark blackish gums?
Ang follow-up question ko is, are you smoking? If you are, syempre, the solution there is to stop smoking. 'Di ba? Pero
Yes.
not all naman grayish or black gums are indication of not healthy. Sometimes people are born like that na medyo dark yung gums nila, 'di ba? Pero syempre, we would want also to know the cause of it. Syempre, it all boils down to your dental checkup as well, 'di ba? So, yon, maybe then kaya siya black or dark kasi baka yung plaque napunta na sa ilalim, 'di ba? Tumigas na siya doon. Maybe kailangan lang siyang tanggalin. So may mga procedures po tayo na mga paraan po to check or to clean our gums para bumalik siya sa health ng gums.
Okay.
Yan.
And then there's another question, are dental implants are better option to jackets or bridges?
It actually, ladies and gentlemen, it actually depends on the case. Siyempre, also depends on your budget. So there are a lot of things to consider in choosing dental implants as to other dentures like yung removable or jackets or bridge. Siyempre, it's the best option actually. Pero siyempre, not all are candidates. Diba? So the dentist has a lot to consider if you decide on having implants. So there are a lot of also of health considerations, bone considerations. So pero all are candidates and that is the best option for now. Yun. So it all depends. Kailangan medyo mapaghandaan nyo at saka syempre yung budget, ganyan. Okay?
Okay, thank you, Dr. What is the cause of fissured or deep fissures in the tongue?
Sometimes, I mentioned earlier, dry yung mouth. Dry yung mouth, kaya nagkakaroon ng fissures or mapping on the tongue. So, sometimes, meron underlying cause niyan, maybe systemic, or maybe you have diabetes, so it's really not just mouth, diba? There are a lot of things to consider also outside the mouth. So baka yon, you have to have your complete blood count or mga blood works to know. And then yon. So pero most likely sometimes, most of the time, the cause of that is just dry mouth. Maybe kailangan hydrate talaga. Hydrate.
Okay.
Yun lang.
Thank you, Doc. So I think this is the last question. Wala na ako nakikita sa what is the best toothpaste, if any? Meron po ba kayong i-recommend based on its chemical composition?
Okay. Actually, lahat naman po ng toothpaste, basta may fluoride, is okay. Any brand din. For me lang, there is no best toothpaste. They are all the same. They contain fluoride, yun naman yung kailangan ng ipin natin. So, any lang. Pero ako personally, ang gamit ko, if i-ask nila ako, ang gamit namin sa family is Happy. Happy. So, some use Colgate, ganyan. So, any brand. There's no best toothpaste for me. Pare-parehas lang sila.
Okay. Thank you very much po, Doctor. Ayan, may habol. What would you advise as a remedy for pangingilo?
Okay, first, earlier I discussed yung sensitivity. Siyempre, first you need to know if, siyempre, you have to have your dental checkup, no? And you need to know if baka naman meron abrasion, baka naman sobra ka mag-toothbrush, kaya nagagasgas na yung tooth structure mo. So, meron ang dami nating causes of pangingilo. Dental caries is also a main cause of pangingilo. So, hindi natin siya matitreat properly if hindi natin alam ang pinagmumula ng pangingilo. So, syempre, papacheck up ko talaga sa dentist. So, yun talaga yung key eh. You really need to check in with your dentist para to know your oral status, di ba? So, from there, doon nila ma-explain sa'yo, masasabi na, ito, kailangan mo ng ito. Kaya nangingilo to kasi pud-pud na yung mga ipin mo. So, meron tayong mga proper proseso para i-preserve ulit or to bring back yung ganda ng ipin natin. So, yun yung importance din ng mga dentist. Kaya kami nandito is, di ba, para bigyan kayo or i-advise kayo ng good oral health and hygiene nyo. Okay? Para overall, magkaroon tayo ng healthy body. Okay?
Okay, thank you very much. I think that's a great parting word from you, your discussion. So I think based on the discussion you've given us a lot of information that we hope have addressed your health, dental health concerns. Kasi nga, maraming myths na na-clarify today. Ayan, thank you, Dr. So,
Okay.
final words pa, Doc, if you have pa. For our audience.
Maybe final words ko, make that appointment. You know, don't be scared anymore because mas kailangan tayong matakot sa magiging systemic effect ng ating mouth if it's not clean, di ba? So, make that appointment. We have a lot of MediCard clinics everywhere around you. So, make that appointment. It's really very important. Our mouth is really very important. Di ba? More valuable than diamond. So, yan. Make that appointment.
Yeah, thank you very much, Dr. So,
Okay, thank you.
Before I turn over back to Quaideen, I'd like to invite Dr. Arnon to invite our audience to visit our dental clinics. Dr. Arnon.
Yes. Good afternoon, everybody. First of all, I'd like to congratulate MediCard on our 35th anniversary. Thank you to Dr. Porlin for inviting our team, of course, represented by Dr. Audrey, who did a very good job in introducing oral health care, hygiene, and to all the diseases that can occur if you do not visit your dentist. Okay, so actually, MediCard Dental, we have our tagline, MediCard Dental, Health Beyond Smiles. That is why Dr. Audrey started with caring for your oral health so that you do not have to undergo any major dental treatments anymore. But just in case you need any care, MediCard Dental is there to support you and to perform any procedure. It is not just extraction. We try to avoid extraction as much as we can. It is not just for cleaning and maintenance. We have a lot of services available now under dental of MediCard, both accredited and our in-house dentists under the our services under our freestanding clinics around the country. We have services such as aesthetic dentistry, complete rehabilitation, root canal treatments of endodontics, implantology. We have our x-rays, we have light cure treatments, oral surgery as well, and everything. No, you will realize that throughout the pandemic, one of the clinics, okay, that is open for patient care is MediCard. MediCard Dental has tried to be equipped and offer its services to all our clients under MediCard. So with that, I would like to thank everyone for participating and thank you for your questions. See you in our clinics soon. MediCard Dental, Health Beyond Smiles.
Okay, so thank you so much, Doc Audrey, Doc Arnon, and Doc Pauline for entertaining our participants' questions. And of course, if just like what Doc Arnon said, you may book a visit on our dental clinics. So flash earlier on our screen are the branches that we have. So now, as MediCard celebrates its 35th anniversary, we can all be proud of the role it has played in improving health and well-being of the Filipinos. MediCard will continue to innovate and find new ways to improve health of Filipinos. We all have a lot to look forward to in the next years with MediCard. So I want you guys to watch our new video. So let's watch this video to learn more.
Oh, right. The letter of approval for my eye checkup. I think that came in yesterday. Let me check the app. There it is. I can go see my doctor now. I swear, if I didn't have a healthcare plan, I wouldn't think to look out for myself.
It's been really hectic lately at the store, and we almost didn't have time for my employees' annual checkup. Good thing MediCard does on-site testing. We can continue with business as usual, and my employees don't have to do more work to get their health checked. Thank God for MediCard.
I used to be able to do it all, but I'm too old to spend my time on long queues. That's aging for you, I suppose. Being able to do these tests at home brings me so much comfort.
come a long way in building a healthcare system that lives up to what we aim to be, to serve as the lifeline of our clients, a bridge to health. 35 years, fueled by a desire to make healthcare affordable and accessible to everyone, inspired by the trust of our clients. We want our members to feel like they can enjoy their lives to the fullest, that they can give their best shot in pursuing their aspirations because they are in their best of health, and that they can take comfort in knowing that the healthcare they need is just within their reach. Thank you for entrusting your health to us. It's what we're here for.
So there you have it. But before we end this talk, we would like to invite everyone for a very interesting topic also tomorrow. So get ideas on how to look good and feel good by discovering the best skincare for you. So see you tomorrow on our skincare webinar. And of course, I would like also to thank our guest speaker, Doc Audrey, and also Doc Arnon, for joining us, gracing this webinar. So if you want to visit our dental clinics, so you may just book an appointment through our website. Just visit www.medicardphils.com, or you may call our dental clinics through our Facebook page. We have the directory there of our clinics. Okay, so I know all of us learned a lot from today's talk. Always remember, maintain a good oral care and hygiene. Keep that bright smiles on you. So ladies and gentlemen, this marks the end of our session. Thank you so much for joining us today. Stay safe, stay healthy, and hope to see you all again tomorrow.
All new places, different faces in a world where changes everywhere you turn.
Find a friend you can rely on.
Hold the helping hand that shares. Keep the company that will truly care.
MediCard.
The company that doctors build.
MediCard.
The caring and the expertise. We're here
To serve you through the years.
for all that life may bring. We're here to help your family live in health and grow your dreams.
MediCard.
Doctors build
MediCard.
the caring and the expertise.
Finding
MediCard, find the healthcare that you need.
in MediCard. Time passes by with a multitude of changes, and every day can pass.
All new places, different faces in a world where changes everywhere you turn.
Find a friend you can rely on.
Hold the helping hand that shares. Keep the company that will truly care.
MediCard.
The company that doctors build. The
MediCard. healthy.